All right, and boom! Hello everyone, welcome to the brand new season 12 of the brand new first episode. Of course, I'm so excited that I lost my words right now. If you guys can hear me loud and clear and comment in the chat right now, boom. All right, let me see here. Who do we have? We have Patricia, we got Letitia, Sortin, Maggie, Leela, Steven, all right, Jackie in the house, Wilson, Susie, Grunam, David, Marianne, Rekha, Faye. All right, I miss you guys so much. How many of you actually miss me when our episode was on a break after season 11? Comment miss if you miss it, all right? I definitely miss you guys, and I'm sure you all had a great time with Shuan. Yeah? Okay, yeah, miss, all right, miss you guys as well. And I'm so glad that, of course, some of you are still on the challenge that is happening right now. And yes, we are going to go for a flush in the next 1 hour. Now, before I begin, I'm so happy to see all of you after a couple of weeks away. And it was a good break for me, but not really a break because I was still very busy. But it was a break from, preparing for the Saturday nights. So do turn on your camera right now. I'm so excited to see all of you after so many weeks or nearly a month, I believe. Yeah. Of course, in between, I was just popping by in Shuan's session. Hi, everyone. Okay, get to see all of your pretty and handsome faces. All right. So now, welcome. And tonight, this is going to be one of the most important topics for all of us as we enter 2025. But more critically, this is a topic that is also very close to my heart. Something that I've always been wondering and trying to find safe and, of course, effective alternatives that are medically approved locally and hopefully for some of you in other countries as well. So now we are in a shocking new era of treatments when it comes to weight loss. And in a short moment, I'm going to introduce to you one of the experts, and he's going to share with all of us the pros and cons, what are some of the options available, and of course, more importantly, to help you understand better, right? What are some of the solutions that are not safe or at least not approved yet? And what are the ones that are basically approved or safe? So we're going to get down into all of these really important questions tonight. And before I begin, I just want to, give some heads up to those of you who are part of the, fruitcake. Congratulations, right? So we will be dropping by 10 of your lucky homes on 2nd December, all right? 2nd December. So these are the list in alphabetical orders for our once a year gluten-free fruitcake, right? So I'm so excited. The gluten-free gourmet fruitcake, right? These are all the names here. So make sure you see your names in there. And not only Chef Chris and I will be dropping by to say hello to personally deliver you your cake, but also it comes with a surprise gift. And we also have an additional gift in there, right? So I'm so excited to be dropping by. How many of you all would love us to drop by at your house on 2nd December? Type in there me. Logis, Malaysia. So sad. Malaysia too far. Cannot drop by. Too far, right? But yes, I will send you all a greeting card this year. We'll send you all a greeting card, all of you, right? Okay, so one last call for those of you, if you haven't yet, we are in the rush of baking all these lovely cakes that we'll be sending to you. And of course, one part of the cake here contribution goes to our family Food for Family initiative, where we feed underprivileged children and underprivileged families in Singapore and Malaysia every bi-weekly, right? So this Christmas, I will invite you all to do good. At the same time, also enjoy your desserts without guilt, yeah? So you also receive our Santa Christmas gift here, right? Which is the cutleries, right? Which is going to be amazing for you, right? Okay, so make sure you guys click on the link to secure this, and we are finalizing the list as we drop by your homes. And for the soup pack launches, right? Congrats to all of you. The sets are already prepared, and you'll be starting to go out first thing on Monday morning to your homes for all the soup purchases. Are you excited? Type in there yes if you are. Right? I'm so excited, for all the bonuses that you guys will be receiving from Monday onwards. Stand by to receive them when you reach home after work, right? And let me know how you're feeling when you receive all those bonuses, yeah? Yay! All right, awesome. Linda, Tai Hyang, Eileen, Shirley, Intan, Lila, okay, Mei Chu. All right, awesome. Now, in a short moment, when I invite this gentleman on the stage, I want all of you to give us the craziest energy, right? Craziest energy as we invite him on stage. Yes, the answer is he. I'm sure all of you have seen a very short message from this gentleman. And before that, just to be clear, right, we got only 6 episodes for the final season, season 12, which was not part of the plan. But as many of you have requested that for us to complete one last season before we enter the year, so we have 6 episodes. Everyone, type in that 6 right now. Let's go. Type in that 6 right now. All right. So, would you like to have a glimpse of what is going to happen in the remaining 5 episodes? If you want to know right now, type in there yes. Otherwise, I'll just skip it and jump in straight into our conversation already on weight loss. All right. Okay, cool. So, of course, today on our first episode of season 12, we're going to have, topics on weight loss. Next week, we are actually going to invite an expert to talk about your spine health and pain relief for your shoulder and neck pain. How many of you are experiencing shoulder, neck, and lower back pain? Type in there yes. Oh, then this is something that you want to make sure that you don't miss it next week. How you can relieve your pain instantly, safely, and effectively. And we had a lot of questions, right? Like, is the neck cracking at the spa or your massage actually safe? Now, the answer is no. Okay, so I'm going to let this expert share more, right? What are the ones that are safe and what are the ones that are not, right? Recently, I see there's a rise of chiropractors on social media doing all the neck pulling activities, yeah? So some of you ask me, if the person pull my neck upwards, right, what will happen? Will my neck detach from my spine? Yeah, so let's get the expert to answer these questions. Now, after the episode, we're going to have the most happening episode, right? What is that? That is on your air fryer. So we have a professor from NUS that is going to come in to share neutrally, right? Is air frying actually healthier? What do you look out for when you're buying your air fryer? Because not all air fryers are created equal. How many of you are excited for the episode? Type in there me, by the way. All right. Yes, Shirley, we're going to have that question addressed, yeah, next week. So we're going to have that. We're also going to have a dentist coming to share about how to prevent bad breath, because some of you is like, I'm drinking a lot of water. I'm not sure why do I still have bad breath, right? And also the fact that how can you keep a proper oral hygiene? So we're going to have a dentist coming and talk about it. And we're going to have a last minute DIY Christmas gift session, right? Where you guys are going to discover how to make your own Christmas gifts. So these are all the special seasons that special episodes that I have in season 12. And the last episode before Christmas, how to prepare for your new year. I will be streaming from Berlin, right? Berlin live in Berlin. While I'm in Germany, I'm going to stream live for that final episode of season 12. All right, so here you are, guys. These are the last 6 episodes in season 12. How many of you guys are excited about what is going to happen from now until early part of December? Type in there, wow, if you guys are excited. All right, I can see the energy now. Woo, okay, excited. Don't miss it. No replays, no repeats. All right. Okay, so as I get into this segment now, everyone, I want you to turn on your camera. Later, I'm going to be selecting some of you randomly for some early Christmas giveaways. By the way, let's put in the chat right now, 494. We got 494. Okay, 496 now. Sorry, 498 now. Okay, 500. Everyone, type in that 500. We got 500 viewers now from around the world. Guys, I want you keen in the chat right now. Let us know where are you tuning in from, right? 500. If tonight we hit the first 800, I'm going to give a gift to all of you, an early Christmas gift. Okay, we got Rotterdam, Malaysia, Singapore, Thailand. All right, we got US. Hello there. All right, wow. Okay, we got Japan. Hello, Japan. All right, awesome. Wow. Okay, a lot of Team Singapore. High five, guys. All right, and Team Malaysia. All right, cool. So let's take a look here, guys. Now, obesity. What is obesity? Put in the chat right now. Let me know what is obesity to you. We heard of overweight, right? But we heard of the word fat, but what is obesity? What is obesity? Okay. BMI over, okay, unhealthy, grossly overweight, what else? Very fat, okay, all right. So let's take a look here. First and foremost, everyone, just for you to look at some statistics in Southeast Asia, yeah? So these are all the Southeast Asian countries. Well, I'm not sure is it unfortunate or fortunately, Singaporeans, we are not number 1. Singaporeans, we always want to be number 1, right? Here we are not number one. So I think it's a good thing we are not number one here. Malaysians, you are leading the poll for the most overweight population in Southeast Asia. All right. I will not tell you all to give yourself a round of applause. Now, and by the way, is this information shocking to you all? Or it's like, I wouldn't be surprised if all the mamak shops and, you know, all the Maggi goreng, nasi lemak, I'm not surprised. Let us know. Zakia, tummy bigger than chest. All right, okay. So, but in Singapore, while we are definitely better, not number one, but let's look at the statistics here, all right? So men and women, as you can see, the rates are actually going up, right? All the way, these are numbers until 2020, there is a rising trend, yeah? And likewise, as you can look at from a global level, yes, we are also on a rising trend. And of course, in Malaysia, over half of Malaysian adults are way overweight and obese. So both of these countries, we got to do something about it, and you better start now. So weight issues are not just about physical. It definitely affects your psychological as well, your emotional parts as well, yeah, especially your sex life, right? And many areas as well, yeah. So these are the areas that your life is actually affected. And if you look at medical bills and expenses, while your weight goes up, your medical bills will also actually go up for your healthcare. And what is the definition of obesity? This is the formula, right? So we basically measure not by your weight alone, but this measurement called BMI. Everyone, put in the chat right now, BMI. BMI, okay? Yeah, a lot of good food in Malaysia, I know. Okay, some of you say, not surprised, but I watch what I eat, that's good, right? So you can scan the QR code, everyone. I want you all to scan the QR code right now so that you can calculate your BMI. Come, very quickly, I want you all to quickly scan your, this QR code and key in your weight and your height so that you can know where you are in terms of your BMI, all right? Now, just to give you all a quick indicator, so what you want is you want to avoid going into the yellow, orange, and red color bodies here. So the measurements are as indicated and reflected below. What you want is to be in the green zone, right? Now, blue zone, then you're underweight, right? Let me repeat. What you all want to target is at the green zone, okay? Now, this gentleman that I'll be inviting here, right? I'm very, very grateful for his time today, where he's going to come in and share more with us. He is none other than Dr. Schenker, and he has a degree in medicine from NUS, and he has such an incredible and impressive background when it comes to multiple situations like gastrointestinal and vascular surgery as well. And of course, he is also the past president in endoscopic and laparoscopic surgeons of Asia Singapore, ELSAS, yeah, and also the Obesity and Metabolic Surgery Society of Singapore. So he has an incredible background here, and I thought it is so important to invite a medical expert to share with us, what are some of these available solutions today to help many of us who probably you have tried diet, you have tried exercise, and you are not seeing results. More importantly, this topic on Ozempic, is it safe? Who is it for? Right? So we're going to go into a very neutral, unbiased discussion, and just again to remind many of our new viewers that are first time here. By the way, for those of you who are new, first time tuning into this show, type in that new, right? And for those of you who are seasoned viewers, where you have attended more than one episode, type in there pioneer. All right, come, put in the chat right now. Okay, so are you pioneer or are you new? All right, Jean new, okay, and Charlie new. Okay, we got a few new ones. Welcome to this amazing community. As you can see, all the live people here from around the world with their cameras on. For those of you who are new, all the experts that we bring on the show, they are not paid. They are not sponsored, because you want to keep it to a neutral perspective. Yeah. So without further delay, everyone, I would like you to put your hands together and join me to welcome Dr. Schenker. Let's give him an applause. Thank you so much, my friend.
Thank you, bro.
Right. Thank you. All right. Okay. So now you see the man live in person. So Dr. Schenker, I know this a weekend and you've been a very busy day for you. Thank you so much for coming here. And by the way, let's look at the love here from everyone from around the world, from 7 different countries tonight we have.
Excellent.
Amazing. I love the energy, guys. Keep it up, all right? So now, and it's always important, I always say, right, when I invite someone to talk about health or weight loss in particular, they must first physically not be overweight. So I was so glad we have Dr. Schenker here, right? And so Dr. Schenker, there's, personally for me, I've gone through a roller coaster, journey when it comes to my weight in the past. And let me show you how I used to look like in my late 20s, right? So here you are. This is how I used to look like in my 20s back in 2012. And of course, this is me recently.
Whoa.
All right.
Excellent.
And this is a journey, right? So over the years, I've tried from, slimming centers, those slimming pills where they have a lot of caffeine in there, which is really bad. I really don't recommend you guys to try that. I've tried, workouts that are different. I've tried different diets. I've tried so many things on weight loss, but of course, the end, one thing that really works for me is calorie deficit and going for weights, and it's consistency, right? It's not like overnight thing.
Absolutely.
So, and counting my calories, looking at my macros. So for me, I think that results that I achieved finally, I was like, okay, I finally got it. But when I look at the world today, there are so many, from non-invasive to invasive surgeries. And every day I keep seeing a lot of very interesting solutions that put out in the market. And I started to ask, which one is legit? Which ones are not? And apart from the legit part, which one are safe and which one is not, right? So I think when it comes to Singapore for healthcare, it is a place that we all can trust, at least, yeah? So I think it's really important to hear from you. What are the solutions that, in the first place, when someone today in Singapore or any part of the world, they are having, overweight, when they come to you, what are some of the medical solutions that you provide to them?
Okay, well, Mark, this is a huge topic, I'm glad you brought it up, and I think it's very important that we address this properly. But the first thing to understand is that everybody is different, okay? Everybody eats, everybody walks and does some sort of movement, workout, all of those things. But the amount of energy that you absorb when you eat and the amount of energy that you burn when you do those activities is different.
Right.
So before we jump into people, I just want to take you one step back to give you a frame of reference before we start talking about people. Now, let's look at cars. I'm sure you like cars. Lots of people like cars. They drive cars. Now electric cars are coming in, but let's just go back to some very basic cars. The concept here is that there's different types of cars. So let's say we have a Toyota, we have a Volvo, and we have a Ferrari. So we have 3 different types of cars. We put the same petrol inside. We drive the car the same way, but the speed, the distance that the car will cover will be different. Okay? So if we only talk about the input and the output, we will not fully understand what is going on here. Because the cars are different. A Toyota is different from a Volvo and it's different from a Ferrari.
Right.
Yeah? So this is very important before we jump into how are we going to help people to lose weight. It's complex. True. Because people are different. So what you did in your journey when you lost weight was very important, that you found a way that you were able to eat less energy, not too much, enough energy that you needed, and then you found workouts like doing weights, you mentioned strength training, so that worked for you. So that strategy, you were able to, since it worked for you, you enjoyed it, you were able to continue doing it, so you were consistent with it, and with that, you started to see results.
Right.
And that worked. This is very important. Now, what I find with a lot of people is that everyone very excited about what's new, what's the latest, what's my neighbor doing, what's my cousin doing, what's so-and-so doing, what's my friend doing. But not realizing that not necessarily because it's new, it's going to work.
True.
If you find something that works, hold on to it. If you find someone you care about, hold on to them. It's very important to go into strategies that works for you. That's the very important lesson that I want to tell everybody, and that is something that whenever people come to me and ask, what can I do? I'm like, how would I know? I just met you.
Right.
You know, in 20 minutes or 30 minutes talking about all these things, I still don't know much about you.
Right.
You know, but you know much more about you. So I can help you with some broad principles and guidelines, right? So coming back to that, okay, so what can we do? Now, we talked about the car and we talked about the fuel and the way you drive and how far you drive and all that. So we come back to the human. So we talk about the individual, your genetics, your family history, your age, your sex, your hormonal levels, whether like ladies, you're pregnant, it's time of the month, menopause, you know, for men, whether you're in the army, you're training, or whether you're out and you're just, you know, back into a sedentary kind of lifestyle. So that is very important to take into considerations, right? And then we need to look at the way you eat, how much you eat, and the kind of activities that you have. So on the one hand, is looking at the individual. So you mentioned about some treatments. So the treatments that we do, and please understand this, the treatments that we provide to you as doctors and healthcare professionals is to help your body correct some of these biological changes. What you need to do is what you always need to do is manage your intake and manage your activity level. So both actions, right, have to work hand in hand. Do you get me?
Yes,
well,
absolutely.
This is very important. If we get confused, oh, I just want to manage my intake and then I'm going to go and do workout, then I will lose weight. But then on the other side, right, you're going through menopause, or you're going through a very high stress period where your body is producing a lot of stress hormone, cortisol, where there's a tendency for you to reach out to high energy food and your body is going to store more fat than usual.
True.
These are biological changes. Or maybe you got a thyroid problem, your thyroid hormone level is low.
So no matter what you eat, how you work out, it's just hard, right?
Yes.
Makes sense.
Correct. So those things are where we come in as doctors and healthcare professionals to help you to address these biological changes that are ongoing in your body. And believe me, we cannot solve all the problems with one medication or one treatment or at one time, because these are events that keep occurring throughout life. Yeah, all women know that at the time of the month there will be some changes in the appetite, hunger, craving. Then at other times they can manage very well their intake. So these things are sometimes with stress. When you're working very hard, late, you come home late from work, you want to have something to satisfy yourself, to feel comforted and relieve the stress that you've been through, right? So all of these things have to be managed.
Okay, thank you. So now there is a very important question that I have in my mind, and I think these are some of the most received questions from the audience before today's session. And the question that I've got here is that between liposuction and fat freeze, right? Which one is more effective? Now, everyone, put in the chat right now, liposuction versus fat freeze, because I think we received over 50 requests. And given the fact that suddenly on social media now there is an increase of advertisements for fat freezing, right? So I want to hear from your professional view. But before that, for those of you who have heard of liposuction or you have never seen how it works, type in there me, right? So I want to show you one of my friend who is just doing lipo, right? Surgeries every day. Let's take a look here.
First thing we're going to do is start with some liposuction. We'll suction the central area that we're going to keep and the outer flanks. She just lost 20 pounds right before the operation as I requested her, but she certainly could have lost another 20 more. You have to be very careful how much liposuction you do and where you do liposuction, because this central area is very damaged from the previous infection, and that she had an open wound for 5 months.
We had 5 months?
5 months. She spent many weeks in the intensive care unit requiring dressing change.
All right. Now looking at it, I feel pain to my stomach. I feel painful watching that. I tell you that pain. So that is basically a liposuction surgery, right? But so coming back to the question, Shankar, what's the difference? You know, which one is more effective?
Okay, so before I jump into whether lipo is better or fat freeze is better, the first step is to understand what are these treatments for. Liposuction and fat freezing are basically body shaping procedures or body sculpting procedures. We are trying to change the outlook of the body. We're trying to remove fat from specific locations. So this is not the same as a weight loss procedure, because we are not changing the weight of the individual as a whole. It's just changing a part of it on one side, another side, or around the neck area or around the hips area. Okay, so this is important. Now, between lipo and fat freezing, one is an invasive treatment and the other one is a non-invasive treatment. So that's another thing that we have to keep in mind, because to do the liposuction, as you saw in the video, first we need to inject some fluid and chemicals into the tissue area so that the tissues get loosened up, and then we put in a liposuction cannula, which is essentially a vacuum. So it vacuums out the loosened fat globules. Yeah, so there is injection and there is repeated passage of this vacuum cannula under the skin. So that loosens the fat and it can release some of these fat globules which can enter the bloodstream. So potentially there is a danger of what we call fat embolism. Okay, so and there's also injury potentially to blood vessels in the tissues. And if that long cannula punctures into the abdominal cavity, then there may be injuries to the organs. So all in all, liposuction actually is an invasive procedure, so it's very important to take a lot of care or talk to your doctor if you're going to have a liposuction procedure, that the doctor is experienced and taking care of you in a setting where you are adequately supported, you have anesthetic, you're under good monitoring facilities during the time of the procedure, and then you can recover and wake up accordingly.
Oh, yeah? Thank you. And I think I personally see a lot of horror stories of lipo gone wrong. So thanks for sharing about that. And from so that is invasive, right? So as you all can see, the whole thought of it, although you are not conscious, but the pain I've heard from a lot of patients after that, they're sharing is that they can actually feel the soreness and that pain for a few days, some even for weeks. Or then they are going to go on painkillers. Now on the other hand, fat freezing, as you say, that is a sculpture, all right, a body sculpture.
Yeah, right.
So, does that really work? While it is FDA approved, but does it truly help someone to, like, from a flabby stomach and you get your abs?
Well, actually, it's
I'm
approved.
very skeptic about it.
Yeah, fair enough. So it is approved because it is able to achieve some level of basically the fat is frozen and then it breaks down and therefore the body absorbs it naturally and clears it from the system. So it is potentially less aggressive treatment than liposuction, because there's no puncture, no cannulation, no insertion of needles or anything into the body. But if very large areas of fat are cooled or frozen, then you can have a lot of this breakdown taking place, so that may be potentially toxic to the body. But normally, if this is done in a controlled fashion with small amounts, this is a less invasive or non-invasive procedure, so it's potentially safer. But Mark, your point is correct. Is it really going to be that effective? So generally, as a doctor, to me, we have to be scientific about it. That's why we have to look at the clinical trials, and we have to look at whether adequate number of patients achieve the result as intended. So one of the guidelines we use here in Singapore very much is we follow the US FDA guidelines. So if the US FDA has approved it, then we are more likely to accept it. And for all of you out there who are not sure whether this treatment or this supplement or whichever is effective, one of the things you can do is check for FDA approval. Because if they are past the FDA guidelines, which are very stringent, then possibly they have a certain safety level.
At least there is something that you could, say that there's some validations.
That's right. Yep. So someone has done the studies and someone has evaluated those studies. Of course, nothing is 100% perfect, but at least they've done the effort. So to assess the safety, and secondly, to assess some level of outcome, at least you can read about it. So those treatments will have a basic outcome measure.
So a few weeks ago, we were on a call, and you were sharing about the bariatric procedures. I think it's something really interesting that I've not looked into or explore. And could you share a bit more with everyone here. Now, by the way, how many of you have never heard before, or probably heard about it, but you're not very familiar with the bariatric procedure, right? So type in that me. Let's look at the chat right now, right? Okay, wow, okay, so let's look at it. It's like, okay, going crazy. And by the way, now everyone, we are 7:05, right? 7:06, everyone type in at 7:06. We got 706 participants from around the world. Thank you so much, guys, for tuning in and for being on time, right? So, looks like we got a lot of people are not familiar with this. So, can you share a bit with us, what is this, procedure? How is it like? And how does it help someone on their weight management?
Okay, so this is a really good question, Mark, and I'm surprised a lot of people haven't heard about it, because right now more and more people have been undergoing weight loss surgery. So bariatric surgery is the sort of the medical term for weight loss surgery, and fundamentally what's happening is that the procedure is carried out to the stomach and the intestine, but mainly to the stomach area, to reduce the volume of the stomach, reduce the capacity and the size of the stomach. And the idea behind this is, if you reduce the capacity of the stomach, you will feel less hungry, one, and two, when you eat something, your stomach will feel full faster.
So it basically helps you to control the amount that you're going to input.
Correct.
Okay.
So it works. And this is the interesting thing. So a lot of my patients tell me that, Doc, actually, I only started to lose weight when I started to eat. Because then when they realize they feel full, then they stop. But if they, otherwise they don't really feel any difference.
Right.
Yeah. So that is the correctly performed bariatric surgeries where you don't have complications and problems, So I think what's very important is we must separate patients who don't feel good or having pain, or they have something gone wrong, maybe they have an infection and then they are vomiting because of that reason, versus procedure. So I'll give you an example, right? So we have simple procedures like a gastric balloon, where a balloon is put inside the stomach, and that balloon fills up the space in the stomach. And these balloons, sometimes they are put in by a scope and then remove, or sometimes now we have the swallowing balloons, you swallow it and then the balloon will then pass out after a few months. Okay,
so let's take a look here. We have an image here. Is this how it looks like?
No. So this one is another type of procedure. This is an endoscopic gastroplasty. So where a scope is put into the mouth and then into the stomach. So through the mouth we go, and then stitches are put on the stomach to tighten the stomach, so that the stomach doesn't expand a lot. Okay. So this is a less invasive way of doing an operation which commonly people call the gastric sleeve, where a keyhole surgery is done. So keyhole punctures are put in, and then during the keyhole, a stapler is passed, and then part of the stomach is cut and made smaller. Okay, so these are different ways.
So the one where you say where you're gonna make the stomach shrink, is that by a procedure where you all will put a balloon inside, or basically you will just tie up the stomach?
So I think you have the balloon in the next slide.
Okay.
If you go to the next slide.
Let's take a look here.
Yeah. Right. So this is the balloon. This is where the balloon goes inside, and then the balloon stays inside. So this one is basically something that is inserted which will eventually pass out from the body. So it's only a temporary treatment. I explained to patient that this is a kickstart strategy. So you want to kickstart your weight loss by having something there to feel full, because sometimes people don't quite understand how little they need to eat to get the ball rolling for weight loss, So sometimes when that balloon is put there, they feel, wow, I really cannot eat. And then you need to be consistent about it, so as you know in your own experience. So when you consistently do it for 1 to 2 months, and then you get into a rhythm, and then realize, okay, so can you do it or can you not do it, and work out. So during this time, actually what our role is as the healthcare team is to encourage patients to eat foods that they will be comfortable eating, and eat the amount of food that is enough for them.
Okay, so this is a treatment that is approved under MOH guidelines, right, in Singapore?
Yes, that's correct.
Who is suitable and who is not suitable for this treatment?
Okay, so earlier we talked about obesity. So we use the weight divided by the square of the height as a measure of obesity. So if someone has a BMI over 27.5, that means in the overweight category, they will be eligible for placing a gastric balloon.
All right.
Yeah. So for surgeries, usually the BMI is higher in the obese category, which is more than 30.
And if someone that has a high percentage of body fat, for example, their body fat percentage could be somewhere between 25% to 30%, and they are the skinny fat where they have a very flabby stomach, but overall the whole body is not really big. Are they allowed to do this procedure?
At the moment, actually, for guidelines purposes, right? Because body fat measurement can be quite unreliable depending on what machine you're using to monitor body fat. So sometimes the home weighing scale might have a fat measurement also, but it may not be very reliable because let's say you have a lot of water to drink, or you had a heavy meal, or you're very dehydrated, that can change the way the machine reads. So body fat percentage measurement is not very consistent.
Okay.
So generally worldwide, the reproducible measure is the measurement of the weight and the height, and we use that to calculate BMI. So licensing of all these medical devices is pretty much based on the BMI.
And what is the success rate from the patients that you have, seen in terms of after going through this procedure? What is the success rate that they have managed to lose weight or maintain their weight?
Okay, so that's a really good question. So all of these treatments that are approved by FDA must produce a weight loss of about 5% in the majority of patients in clinical trials when they subject the patient to the trial.
Okay.
So what we see is that if you do an intervention like a balloon or a procedure, patients are losing weight about 10 to 15% from the starting point. So that gives them a kickstart. So that's generally what happens. Now, what is very important before we go into it is the motivation, that an individual must really want to lose the weight. Because what I find sometimes is that people come because they are pushed by the family doctor or some relatives, or sometimes parents bring children and the children are not really motivated. I'm not talking about children, but I'm saying that you're 20-something, but at that time, I always like to talk to the individual patient themselves, sometimes by themselves, because then ask them, is this the right time? Are you ready? Do you really want to lose your weight now? And sometimes, remember how it's like when you first graduate, then you have a job, then you start to earn money, you want to go out, you want to eat, you want to enjoy a bit of the good life. So maybe that's not quite the time that you want to tackle the weight. People need to be ready and motivated to feel that the weight is something they want to address. Like Mark, you were telling about your story.
Right.
I think there will come a time in everyone's life when suddenly you realize that, I've done this and this, but I think there's this thing that's a problem, I need to fix it.
Yes.
And I think that's very important. So to your question on losing weight, right? We know in trials that patients will lose weight because they're all in a clinical trial. All of them are tracked and monitored by specialists. But in real life, I think if we look at people who are motivated and really want to lose weight, all these tools can really help them.
So does it mean that after you go through these procedures, and you can eat burgers, potato chips, and say that Dr. Schenker said that this will help me in my weight management? It doesn't work that way, right?
No.
Your diet still matters a lot. Huh?
Absolutely. Mark, I want to go back to something you mentioned before on a previous talk show, because I've seen some of your stuff in the past. I mean, you are Asia's juice guru after all, right? And I think the question to you was about pineapple tarts and how many pineapple tarts you can eat. And I remember you made this answer and you said that during Chinese New Year, you eat pineapple tarts, enjoy it. Because that's the only time you're eating the pineapple tarts. The rest of the year, you're not eating pineapple tarts. And that really reminded me of when we were kids. That's what it was like. Always look forward to Chinese New Year, Hari Raya, Deepavali, because these are the times we get to eat special foods.
Yes.
We visit our Chinese friends, we eat pineapple tarts.
Yeah, because my mom makes it, So,
right, there you go.
Right.
So I think the point that you made is a good one. It's not that this food is a bad food. It's just that if we know when to eat it and how much to eat it, and we allocate that time for it, then we are winning. It's just that you're not having the burger and the fries every day.
Yes.
So I think this is something that if we can understand that, and this is what I want to put across, that weight loss should not be a torture. You should not be standing over the patient with a cane and then, no, you cannot eat this, you cannot eat that. So, that's the understanding that we want to get across.
Thank you. Now, this is the next one which is on the list here, and let me just quickly, flesh this out. So here you are. All right. Ozempic. Ozempic has been a very big topic right now in the States. Everyone is talking about Ozempic. How many of you have heard of Ozempic, by the way? Type in there yes if you have, right? So, what are your views about Ozempic, and are they really available now in Singapore, or it is still not available yet?
Okay, so Ozempic is a medical treatment which has been licensed for treatment of diabetes since 2017 by the US FDA. And the results were so good in terms of weight loss that the medication was also licensed in 2021 by the US FDA for treatment of obesity for weight loss. Now, let's take a step back, and what is this medication? So this medication is actually what we call a GLP-1 analog. That means it is a medication that mimics the action of GLP-1. Now, this is a very, very interesting molecule. So actually our gut is talking to the other parts of the gut. That means the stomach, the intestine, the gallbladder, the pancreas, the liver, as well as talking to the brain by secreting all these chemicals, or what we call gut hormones or incretin hormones. So these chemicals carry this signaling to tell the brain to eat more or eat less. So GLP-1 belongs to the group of satiety hormones, or hormones that signal that we are full. So these chemicals are secreted after we eat. So if you take a medication, GLP-1 medication, you will feel as if you have eaten. So it will drop your feeling of hunger. And when you try to eat, you will feel full already, because you're already like halfway full, as if you have eaten. So as GLP-1s go, the first generation of GLP-1s came out more than 20 years ago. So that medication was called exenatide, and then the next generation of GLP-1s came out later. So the initial ones were very difficult to use because they were twice a day treatment, twice a day injection. Then the next generation was once a day injection. And this, I will call it the third generation, semaglutide, which is what Ozempic is. It is a once-a-week injection. There are a few other drugs in that same once-a-week injection dosing, but it so happens that Ozempic seems to produce the best weight loss.
Any side effects that you have heard so far from the people that took it?
Okay, this is actually, GLP-1s are naturally produced by the stomach and intestine. Okay, so because of that, the drug treatment actually has very low side effects compared to other medications that were used in the past. So actually right now in the field of treatment of diabetes and treatment of obesity, right, we are moving towards using natural agents. So to everybody who's thinking that, I want to do naturally using natural treatment, actually this is actually the shift even in the medical space. Maybe sometimes doctors don't fully understand that to be able to explain that to you, or when they try to explain it, it's so complicated that people don't quite get it, but this is the shift. Why? Because it is always useful to use natural pathways because your brain understands it. So in terms of side effects to your question, it's actually got a very good side effect profile. All drugs, when they are given to you as patients as a treatment, can create those kind of what we call allergies, rashes, headache, those things, those side effects, because of the formulation of the drug, or sometimes it's combined with certain binders to administer the drug. So there's some side effects from that. But by and large, the side effects from the GLP-1s are quite low and usually can be managed by reducing the dose and adjusting the timing of the treatment according to the patient's symptoms.
So if today, some of us are coming to you and say, between Ozempic and the bariatric, surgery, which one has a lesser, risk and side effects?
Okay.
I'm not sure is that a fair question, but
it is that
today I'll just come to you and say, hey, Dr. Schenker, you know, I want to lose my weight, right? I want to manage it. Which one among these two?
I think that is a great question. And let me tell you the facts in my own practice, okay? We look back at our data for the last 5 years, and we saw about 750 patients for weight loss treatment.
Oh, that's a lot, huh?
And what we saw was 1/3, as patients come and see us, we have 1/3 of the patients going for procedures, 1/3, 250. And we have 500 patients who actually went for lifestyle changes, dietary modifications, and the use of medications. Okay, so what I'm noticing that in the last 5 years, the shift towards medication, because now we have these newer medication, is getting stronger, and therefore I feel that we are able to reset some of the dietary and lifestyle habits with these medications, and when it works, everyone is happy. So let me give you the example of cardiac surgery. Okay, let's go back 20 years. You would remember as a kid, right, that people got heart attack. Next thing, what do? Go for heart bypass. Okay, but that has shifted because we went from heart attack go for heart bypass to heart attack go for heart ballooning and heart stenting. Then we also have the introduction of lots of newer medications like the statins, right? And of course the blood thinners. So with newer medications that work so well, even the need to go for ballooning and stenting also dropped. So in my career, over the last 30 years, I graduated in 95. So
you still look very young.
So what has happened is that we have seen a drop in surgeries across the board. I can even talk to you about this in cancer treatment. So to me as a doctor, I want to give the best treatment to my patient. I want to give the safest treatment to my patient. And the best way to do that is to use small treatments put together, because we minimize the risk and we optimize the outcome. You get what I mean?
Yes.
Yeah. So there's no question today, if you came to me, you say to me, doctor, I want to do operation to lose weight. I'll look at you and say, bro, this is 2024. We got so many options on the table. Why you choose the last one? You get what I mean?
Yes.
Yeah.
All right. I hope that gives you all a good clarity. Now, by the way, we're going to take 3 questions for Dr. Schenker. Right? Do hit in the chat right now if you have any questions for Dr. Schenker. Right? And this is really, really interesting. I think at least for me tonight, I'm learning a lot from the conversation. And I think like what you mentioned, right? We have come a long way. There are so many solutions available out there, and the question is always, are we even aware of those solutions? Rather than, unfortunately, because it's so controlled by the Ministry of Health in different countries, so the marketing, the publicity, the awareness could be restricted compared to those unethical methods that are today available easily by, Tom, Dick and Harry that's promoting it. I think that is a pro and cons there.
Yeah, it's a bit difficult.
Yeah, I think it's really good. All right. Okay, let me see here. Any side effects for Ozempic? Yes, definitely there is. Okay, let me take one question here from. Okay, maybe just take from Reggie first. Is it okay for someone who is not obese or overweight to use Ozempic just to be even more fit? I think this is a great question.
Yes.
What are your views here?
Actually, this is a really, really good question. What a lot of times people do not pay attention to when they look at the weight loss outcomes is how much of the weight loss is fat loss and how much of it is muscle loss. Now, one of the very disturbing findings, there's disturbing findings from the trials on the use of medication for weight loss, is that there's potentially a lot of muscle loss going on, and as high as 30 to 40%. So why would you go through a treatment and then end up losing so much of muscle? Now I can explain to you why that happens. Because when you go on to a treatment where you're not eating much and at the same time you don't do anything, basically you're very sedentary, you still go to office, you come back, you eat the normal food, but you're eating lesser because you're on medication, your appetite is suppressed. But unlike in the past when we use medication, there's a lot of side effects. So patient will stop after 2 weeks or 4 weeks. But these newer medications have lower side effects. So people continue for 3 months, 6 months, 1 year. So when you continue for a prolonged period, what happens is that you are inducing a state of semi-starvation in the body. So your muscles, therefore, are also weakening. So to avoid this, what's very important, and this is not just for the sake of being natural, when you're eating less, you still need to work your muscles.
True.
As simple as walking, climbing stairs.
Or not, you
just
lose it,
doing,
right?
Yes,
Yeah.
you don't use it, you lose it. You said it, Mark. It's very, very important. So to your question, if you want to get fitter and stronger, you cannot get that by eating steak every day.
Yes, it doesn't work that way.
It doesn't work that way.
That's why people in the, when they are in space, they have to work out certain
Exactly.
hours, right? Because they are
Yep.
on already a certain spaceman food.
That's
they also
right.
lose their muscle. Yeah?
They don't have gravity.
Precisely.
So they lose the bone density as well. They get osteoporosis when
Right.
they're in space.
Thank you. All right, now last two questions. Can you scroll? I saw one very good question here from Maggie. All right, let's go up here. All right, and where's Maggie? Okay, now for bariatric surgery, what is the honeymoon duration before we start putting on weight?
Okay, so Maggie, that's a great question, but there is a honeymoon duration for everything, including the marriage, right? So in terms of other treatments also, when you take tablets or injections or you put a balloon or surgeries, all of these will have the initial great result because everyone is so happy and ready to do these things. So there is no hard and fast rule of how long is that time. It could be 1 month, it could be 3 months, it could be 6 months. Now, I'll put it the other way also, that everyone is different. I have people who really are working very hard, but their bodies, it's very hard to lose the weight. So sometimes it's just slower than everyone else. And then sometimes my nurses will look at them, sure not, you're really doing this and doing that. Then we really check the patient, and yes, actually the patient is doing a lot of things, but some patients just don't lose the weight that fast. But the one thing that I can guarantee you that everybody, after they lose weight, will hit the plateau. It will happen. So whether it happens in 1 month or 3 months or 6 months, it's going to happen. The second point is, don't be afraid of the plateau. Because when your body weight starts to stagnate, what it really means is that from a biological standpoint, your body is trying to figure out, hey, what happened? Is there something going on? Is there a crisis? Are we ill? Are there, some part of the body not doing well? Or is it new normal? So the most important thing, and which is what a lot of people who fail to capitalize on this, they go back to old habits and then they will rebound and go up. But if you maintain the habits, your body will get used to this new weight level as the new normal, to use a cliche, then you can start to lose weight again. Okay? So this is a normal way that the body sheds weight in healthy individuals.
All right, thank you. All right, we're going to take one last question. And before that, I saw some repeated questions on, is intermittent fasting effective when it comes to weight loss? Now, the question that I'm going to pose back to those of you, have you seen anyone on intermittent fasting actually gain weight? So, rather than being too fixated on intermittent fasting, right? There's so many types of fasting. Yeah? Now, to me here is this. You are basically eating lesser. Intermittent fasting is just basically helping you to eat lesser. But that doesn't mean that even if you are having the 8 hours window of eating, and if you eat the wrong food and food that's high in calories, even your intermittent fasting is useless. So intermittent fasting is basically cutting down the number of hours that you are eating while you are awake. Secondly is that what you are eating during the 8 hours is really important. So it has shown huge success globally for people that's going on intermittent fasting, like I said, unless they are eating the wrong food. And what you want is that understanding your digestive tract. You don't go to bed at 12 and you have your dinner at 11 p.m. Right? So you want to end your dinner earlier, and that definitely helps in terms of your weight. Does that clarify, my friends, for those of you who are asking about intermittent fasting? All right. So don't be too fixated with all the new gimmicks of fasting. There is always a new terminology for it. Fasting is fasting. Basically, you just eat lesser. If you go back to the Stone Age, people don't have breakfast, lunch, and dinner, because foods are limited,
Scarce.
right?
Yes.
Scarcity, right? You probably kill one animal and the animal will last you for the next few days and maybe for weeks.
That's right.
And they eat, fruits, seeds, and that's why they don't have weight issues like what we have right now. So once we went into the industrialization age, in order to control productivity, they have to introduce breakfast, lunch, and dinner. Otherwise, everyone is just, oh, I'm hungry, I'm going out now to find some food, So does that make sense, everyone? So the whole weight issue, the breakfast, lunch, dinner started with industrialization. High tea is a lifestyle. There's no high tea back in the 1960s, So I hope that clarifies. Okay, now I'm going to ask one last question here for Dr. Schenker. I think this is really great. Okay, let me just go up here. Not so much on Ozempic already. So, too many. Suddenly I think that you're Ozempic expert. All right. Okay, let's go down. Sorry, let's go down. Okay, let me pick one good one that can benefit everyone here. Okay, slow down. All right. Okay, we got one. I'm not sure is this under your alley, but this is from David, right? For patients under medications,
like tamoxifen,
right? Yeah, be administered with Ozempic weight loss drug. So basically, he's probably asking that if anyone on medication, this is better to go and consult their doctor.
Yes, I think this question, obviously, if someone is on that kind of treatment, they are probably undergoing cancer treatment, so that is quite sensitive, and I think each person has to be individualized, so it's best to talk to the oncologist. We do get I do see patients that referred after cancer treatment, or along the journey while they're being treated for cancer as well. So we have different advice at different points, but it has to be individualized. So there's no standardized answer.
Okay, now this is from Rajaram. Some beauty salons offer body wrap. Is that safe? And technically, it's not only safe is that effective, right? So from FDA and MOH standard, I don't think that is scientifically proven. But what are your views on this?
Look, I think these are treatments that people like to go for because they feel good, they feel relaxed. Even my staff, go for spa treatments when on their off day or their birthday or something like that. So I think let's not mix up treatments that make us feel good and relaxed and de-stress from and say that there's a weight loss treatment it helps us towards our well-being journey for sure, but I think I'm a data-driven person. If you tell me that rap can lose weight, then show me the data right?
Yes.
But rap is cool, it's fun, it's relaxed, so I think no harm going for that.
Okay, all right, thank you. So Dr. Schenker, what is your final words or advice for those of us who are struggling with obesity or with our weight? What would you say to all of us here as we are entering 2025 now?
Mark, that's a great question. This is what I tell everyone, that please understand that the science tells us that genetics and biology has 50% at least of the problem. Okay, so that means whatever you're doing, whatever you're eating, whatever kind of workout you're doing, please understand that you can address at most 50% of your problem. There's another whole biological element. So if you are struggling, come in and talk to somebody who understands that and will be able to help you to work out all those different aspects in your biology that might need to be tweaked, so that your actions can then be better synchronized hand in hand with your own biological makeup.
All right. Thank you so much for the advice. And if any of our viewers here would like to seek consultation, where can they reach you? Where's your practice available today?
So I run a clinic at Mount Elizabeth Hospital, and I also go to HMI Medical Center, which is the outpatient center over at Farrer Park area. So if you need to reach me, that those two places can.
All right. Wow, thank you. All right, so now everyone, share with us what is your takeaway from the conversation that we had this evening with Dr. Schenker. Very quickly, just put in the chat right now. Let us know. And again, we apologize if we can't answer all the questions. You guys have really great questions. We wish we could address all of them. For those of you who are asking about recommendation of protein powders, I've said that in one of the episodes where we had one of the experts to cover that. The problem is that there's a lot of synthetic chemicals, and today, in order to make the protein powders taste good, there's a lot of superficial sugars that have to be added in, right? Like your maltodextrin, sucrose, fructose. And of course, that is also to increase the calorie intake. So again, from a nutrition standpoint, definitely that is not the best alternative that, I would personally suggest. Look out for collagen, which is actually equals to protein as well. And read the ingredients always. Look out for, it should be containing just your bovine collagen, right? You shouldn't be having a whole bunch of ingredients that you can't even pronounce them. So that is a better choice compared to your protein powders, and of course it also contains soy isolate and dairy. For some people, that is lactose intolerant, you'll feel very bloated. Right, so I hope that answers the question. All right, so wow, thank you so much. Okay, eat healthy, work out regularly. Let me see here, what else? Okay, weight up, medical up. Okay, all right, different ways of weight loss. Thank you. And Kim, Jenna, can you pass me the gift as well? For your time and contribution this evening, I really appreciate that. We have prepared a very small gift for you.
Okay.
And also, we'll be feeding 8 children on your behalf.
Oh, wow.
All right, so here you are, Dr. Shankar. This is something for you. Let's take a nice picture here together, everyone. Okay, everyone, turn on your camera. Let's take a selfie together. All right. Thank you. And there is another bag here, which
thank you so much.
Some of the nice stuff that you can share with your family.
Excellent.
It's a pleasure, my friend, to have you with us today.
Thank you.
Thank you so much. Everyone, can we all give Dr. Shankar a massive round of applause?
Thank you, guys.
All right, so we will be sharing Dr. Shankar's clinic details, right, in the chat, so that those of you, if you want to seek, further advice, which tonight, if we can't address all of your questions, do so accordingly, all right? So, yes, and also I wish you in advance Merry Christmas and Happy New Year, my friend.
Thank you. And Merry Christmas, Happy New Year.
Thank you so much. All right, thank you.
Fantastic.
All right. Okay, so let's give it a round of applause, everyone, one more time. All right, amazing. Thank you. All right, so now, let's get down now into the last part. So we have actually prepared some of these, and I saw many of you asking about, can I have the slides, can I have all of that, right? How many of you actually think that all these amazing contents that we have, you would actually like to get your hands on it? Type in at me. All right. Okay. Right. All right. So now, because we are ending our, season in 2024, I'm going to talk to my team and see how we can make all these amazing contents that has gone through a lot of research, a lot of, time and contribution from the different experts for all the episodes, which also always includes a recipe, right? So I'm going to tell my team to see if we can put them all together in a place that you all can actually use it. Is that okay, everyone? All right. Yeah, welcome. All right. So now, very quickly, guys, I have basically two more last announcements here, right? 2 more last announcements here. And those of you who are very busy yet, you want to eat some simple to prepare home cooked dishes. How many of you would love to discover easy ways to prepare them? All right. Thank you so much. All right. Comment yes if you would love that. All right. Can we go to slide 48? Okay, everyone. This is a special gift that I'm going to be giving to all of you tonight. Although we didn't hit 800, we hit 700 plus, nearly 800. How many of you want to give first? Or if you do not want to give, then I'm not going to put it up. Okay, you want to give? Yes? All right, let's take it out here. Everyone, this is a session, no cook, easy meal with Chef Christopher. It's free, right? Sign up right now and prepare these ingredients. We are going to explain to you, and we're going to show you. It's a cook along with Chef Christopher, right? 18 November, 8 p.m. to 9 p.m. Don't miss it. This is live. Okay? All right. Now, last 2 more announcements before we end, okay? The second thing here is that I'm really, really honored and excited on behalf of the Farms Asia Group. After our recent licensing of our, courses to 2 universities, it has been well received. And I wanted our community to have a chance to discover this amazing certification in health and nutrition business. And at the same time, also we are launching some initiatives where you can get paid. And some of you, how many of you here, in fact, you will love to be having a career with us at Farms Asia in various countries? Type in there, me, right? So, okay, wow, if you love what we are doing at Farms Asia with all our different brands, right? Now, guys, don't miss this. Tomorrow, I am having a session at 2 p.m. to 3:30 p.m. 17 November, Sunday, live. Scan this QR code or click on this link to register right now. Tomorrow, I'm going to share with you about this certification and also what are some of the immediate opportunities and positions that we are hiring in our HQ and of course different parts of Farms Asia brands. Some are full-time, some are part-time. Yeah, we are looking for volunteers as well. So all of these I'm going to share with you all more tomorrow, all right? So I'm really, really excited about that. And last but not least, okay, last but not least, oh, Logis, thank you so much. All right. Okay, last but not least, everyone, the upcoming episode. Turn on your volumes for those of you who have lower back pain, shoulder pain, neck pain. Let's take a look here.
Coming up this week for the brand new Season 12 of Dr. Mark Leong's Club. Say goodbye to back pain with chiropractor's secrets that truly work. Get ready for a life-changing episode featuring special guest expert Dr. Juan from Aspine Wellness. Tired of back pain holding you back? Dr. Juan and Dr. Mark Leong are here to reveal powerful chiropractic techniques, simple exercises, and lifestyle hacks that can banish back pain for good. Live pain-free, move freely, thrive again. Your journey to a stronger, healthier back begins now. Don't miss this exclusive event. Tune in and unlock the secrets to a pain-free life.
All right, now I am going to be giving away a spine care set for free that is worth $200. Who wants to receive that? Type in at me, type in at me. Wow, okay. Now, sponsored by Farms Asia, all right? So guys, I want y'all to scan this QR code right now. And we are going to be picking one person to receive this giveaway of your spine care kit. All right? One person will receive this. I'll be announcing the winner, all right, at the beginning of the show happening next week. Don't miss it. Live on my second episode of Season 12. All right? I highly recommend you guys to tune in. In fact, in our years of Farms Asia, this is the first chiropractor that I've only invited. And there is a reason why, right? So I don't really, okay, so maybe the word is this, right? I'm always very skeptical about chiropractors because from the medicine world, they are always considered as pseudoscience, right? So compared to physios. And, it took me a lot of understanding about some of the chiros and that are unethical and also some that are ethical. And after understanding from Dr. Juan, I basically got a very good understanding of what they do, how is it different than other chiros, and that gave me certain comfort to invite them to share with our community and our viewers at home, right? To deal with your spine, your posture, and your pain management differently, yeah? So make sure you guys don't miss next week's episode. And like I mentioned, for Season 12, which is not part of the planning for 2024, but due to the massive request, I'm specially only doing 6 episodes in Season 12, right? Make sure you guys don't miss all of these episodes. And my final episode, I'll be airing it live from Berlin, Europe, from my hotel room, and I'll be getting some of you some beautiful Christmas gifts from the Christmas market in Berlin. Okay? How many of you guys are excited, by the way? Type in there, yes. I hope you guys are loving it. By the way, let me know if you guys are loving all the lineup episodes in Season 12 so far, especially on your air fryer, which I'm finally putting to a rest. Yeah? You guys loving it? All right. So initially I thought, okay, my Europe trip with my family, I'm going to give it a break, but I find that, you guys are so amazing. I'm going to do one even though I am overseas. And for the new year, I'm going to start new year, right, on Season 13, on how to get in shape before Chinese New Year. And I might invite some very special experts to come in and talk about your zodiac signs. How many of you guys think that there will be something interesting for us to start my episode, brand new season in the new as well? Oh, okay, y'all love it, huh? Okay, so I'm going to cover water dispenser, air purifier, and mattresses in 2025 season 13. Oh yo, all of that line up already. A lot of them very kanchiong. And also we're going to have the worst supplements to take that you should avoid wasting your money on. That is going to make a lot of pharmacies and supplement sellers very angry. So we have got an interesting lineup of topics that are coming up with different experts that I've been inviting on my show. Make sure you guys don't miss it. CC says, how about air fryer? Hey, CC, you sleeping just now? Sleeping? Okay. Guys, did I say that I'll be covering air fryer topic in one of the episodes or not? Which episode is that? 2024 or 2025? 2024, happening in another 2 more episodes. Alright? Okay, cool. Alright, so big love to all of you. I look forward to see you guys tomorrow afternoon, Singapore time at 2 p.m. And by the way, anyone here loves boxing and we're watching Mike Tyson match or not? Type in at me. Anyone here? Mike Tyson match. You long. I tell you, angry. So my next 1 week I have to wash toilet because I was, putting my hopes and dreams that Mike Tyson will win. Yeah, long. I should have just watched some weight loss videos. Yeah, so sad. Okay, anyway. Okay, big love to all of you guys. Alright, I would like to invite all of you, the pioneers, you know what is the drill. For those of you who are new to us, every time when we start the show, I want you all to say boom. And when we end the show, I want you all to say a boom as well. Why? This signifies energy in life. This signifies abundance. This signifies that you're gonna have the best blessings in your life and you're able to overcome whatever challenges that comes your way. Alright, are you guys ready, everyone? Turn on your camera right now. We're gonna take a selfie here. Team, help me take a picture of everyone here. Alright. It's so good to be back. I missed all of you. Big love. I hope you guys are enjoying tonight. By the way, are you guys enjoying so far? Yeah? Season 12, episode 1. Cool, right? Okay, big love. Okay, everyone, at my count, are you all ready? Are you all ready? Okay, let's go, let's go. 3, 2, 1, and boom.